Yay Networks.
Welcome to another episode of Plastic Surgery Uncensored. I'm your host, Dr. Rady Rahban, and boy, do we have a show for you. It's a very specific show, but for those of you who this may affect, or for those of you who know about this, you'll find it very informative and interesting. It's about lips, and it's about trauma to the lips and the effects of scars on the lips and what their options are and how it happens and everything there is to know. As always, we're always so lucky if we have a guest who can come on the show and give us their insight, their experience. And I am very lucky to have a lovely patient of mine who will join us and talk about her experience and her journey through this traumatic lip injury and everything there is to know. So as always, welcome to the show. Chavona, how are you?
Good.
Welcome. So let's just dive right in. So tell me what exactly happened, if you don't mind. And I know obviously it's kind of a little bit traumatic, but hopefully we're way past that point and you can kind of recant it and help everyone understand what we're talking about.
Okay, so a couple of years ago, I had a really bad fall, tragic accident, and big scar to my lip, to my face, and it was just devastating. I felt like the world stopped.
Right. So tell me a little about this. You stumbled, you tripped, you hit concrete. What exactly happened to your face and your lip?
I tripped down into like a gutter gully and just completely fell. Right. I fell on my face. I tried to catch myself. I broke my wrists. I messed up my lip, my chin. I displaced some of my teeth. I broke my maxillary bone. So
it was pretty traumatic, as you can sound.
And
it was such a fluke, right? I mean, it was just like, it wasn't like you were drunk. It wasn't like you were in the dark. It wasn't like you were on some slippery slope. You're just like minding your business, walking like every one of us does hundreds and hundreds of times a day. And you just lost your balance and boom, you hit this concrete, I'm assuming, or hard surface and sustained all these injuries, right?
Yes.
It's nuts.
Devastating.
Devastating. And it's devastating in particular because you're beautiful, and those of you who are listening, a beautiful young girl. And aside from obviously breaking your wrists and displacing your teeth and all that, here you have this sizable gouge, right, in your lip, right? So you get rushed to the emergency room, correct?
Right.
Okay. And then I'm assuming, you get to the ER and describe what had happened to your lip in specific, like was when you say laceration, but tell me about what it was like.
So the right side of my lip was just out. The meat was it was just out. My teeth had went through some of the inside, and I had cuts on my chin. So when I get there, the first thing they say is, wow, she needs a plastic surgeon. So I hadn't seen myself yet. So I knew it was pretty bad. So they put me right into surgery. They started working on, my teeth, and the bone there was the first thing. And then they sewed me up after being sewed up, even though it was done by a plastic surgeon. I don't know who or where they found him. I'm very thankful for him. So I assume it could have been even worse, but I was left with this pretty gnarly scar on my lip, and the shape didn't go back to what it was. It stayed very big. So it was just very uneven, and I just didn't know what to do. I cried. I didn't want to go anywhere. I didn't want to, I was in this place of, what do I do now? How does this go away?
Right. So let me help describe a little bit of what happened. So often when people fall, in particular near their face, your teeth almost always will go through your lip, right? You fall down, kids do it all the time, adults do it all the time. Your teeth are actually quite sharp. And sure enough, you split your lip on the pinkish side, right in the front where you can look. People think about cutting their lip on the inside. We're not talking about that. We're talking about right in the front of your lip where it's totally visible. You have it split it right in half. And as you were saying, the flesh, which is the lip muscle, had separated and became quite jaggedy, because I obviously saw the photos of your trauma. And it becomes a crush injury in that it's not like a laceration that you cut yourself with a kitchen knife, nice and clean. This is a crush injury. So it looks almost similar or akin to like a dog bite, where things are kind of all discombobulated, edges are crushed, and it's very hard to see the anatomy. So that's sort of how you started. The injury was on the outside and on the inside, because it's usually the tooth goes through the inside all the way through the outside. And so, yes, what they did was the right thing, which is for people who are like, oh my God, if this happened to me, what the hell would I do? You pray to God that you go to a hospital where there is a plastic surgeon on call. Many, many times people don't have that option. They're in the middle of nowhere. They're on vacation. They're wherever. And so whoever is there, if you're lucky, will sew you up. But indeed, you did have a plastic surgeon who did sew you up. And let's assume he did the most incredible job he possibly could. Naturally, you're sewing up a traumatic wound. This isn't a plastic surgery like you're doing a nose job or a facelift and everything's clean. This is a big mess. So they sew you up, and lo and behold, once everything heals, you're left with this quite a significant visible scar on your lip, as well as this sort of asymmetry. And your right side of your upper lip was like maybe twice the size of the left side of your upper lip, right? So here we have a scar plus this really significant asymmetry. And here you're left with this. And the reason why we're having this episode is because people get scars all day long. I mean, they fall, they cut their knee, they cut their back, they have scars on their neck, on their forehead, so on and so forth, so on and so forth. So what makes this special? What the hell do we need to show about this for? Because the lip is completely and totally different than anywhere else. It's the most expensive real estate in the country. It's like prime Beverly Hills real estate. It's like an eyelid. It's unique. It's limited. It's fragile. It's sensual. It's smack dab in the middle of your face. It's not hideable. And so what happens is it's becomes a lot more significant in terms of how it affects you than the scar that's on your lower back or your C-section scar or, frankly, your breast scar that's ugly. So here you are. How old are you?
I'm 33.
So 33-year-old, beautiful young girl. You sustained this major, terrible sort of fluke accident, and you've now have this thing on your lip, and you're just managing it. So what do you do? How is it affecting you? You mentioned a little bit, because it's really important to understand the psyche of this. The reason we're having the show and why I mentioned it and you're like, oh, and then you're like, fine, I'll do it, is because there's a lot of people for whom these kinds of things end up entrapping them in this horrific state of life. And you wouldn't know it, or you would know it, and they're just like almost in prison as a result of this injury or a dog bite or a knife injury or something. And like, nobody realizes how miserable you are.
100%.
So tell us a little about that experience of once it had healed and what you had to do and how you managed the psychology of having this thing on your face.
I'm just so thankful to have a really great support system. But once it did heal, I mean, almost immediately, as I'm in the hospital in the bed, I just started Googling plastic surgeons, dentists. How do I recover from this? And once I got out and saw myself and I healed and the swelling went down and I saw what it was going to be, I didn't want to go anywhere. I didn't want to take pictures or go out, and I was very insecure. It was different. It was something that had happened in this split, a second. So it changed me very quickly, and I didn't want to go anywhere. I didn't want to be seen. I didn't want to interact with people because I didn't want the questions. I didn't want to talk about it. Then two, I felt insecure. So I'm doing all the research. Is this going to go down? Where can I, what can I do to fix this? And immediately it was like, okay, plastic surgery is an option. So I start looking at doctors and looking for someone that had been through something like this, like me. I was looking for before and afters. Can this get better? Will this get better? How many surgeries do I need? Who's going to be that person that's going to help me get through this?
So before we move on to what you did in order to actually move on, I kind of want to, and obviously I know it was a traumatic experience, but I want to touch on the psychology of this, because I think this is really powerful, because something so insignificant like a fall can forever change your life. And here you are 30, how long ago was this?
That now 19, like 3 years ago, I was 30.
3 years ago. So at the time you were 30. So here you were, 30-year-old, arguable confident. I mean, I'm assuming you were a pretty confident young lady, right? You didn't have any real major insecurities. You're attractive, you interact, and boom, this happens to you. And this suddenly you understand what it is, this concept of insecurity. What the hell does it mean to be insecure? I was fine just an hour ago. I could have a conversation with anybody, look them dead in the eye. And now all of a sudden I understand what it means to be insecure. And, for those of you who are secure, you always wonder, like, what is it? Why are people insecure about their nose? Why are they insecure about their mole? Why are they insecure? Well, this is why, because there's something, in your instance, very, very understandable, that changes the way you see yourself and you think the way people see you. So before you started fixing things, tell me about how your interactions were with people. Because this is what I want to really focus on, is the psychology of how people exist when they feel a certain way, and how it impacts their daily lives, their interactions with their boyfriends, their mothers, their workers, their dates, etc. If you can just touch a little more on what you did with this lip. How long did you have the lip look not the way you like before you started engaging in surgeries to fix it? How long was that?
Honestly, immediately. I mean, right after I healed, I saw you like 3 months after.
Right. So
I went right into it because I wanted to know what I had. It was sad. I was sad. I truly was sad. And I mean, it just happened right around that COVID time. So my interactions were already limited anyway. So I can't elaborate as much, but I wasn't putting in extra effort to see anyone or be on camera or take photos or go out. I truly felt sad all the time. I was depressed.
Right.
100%. At home,
because when I met you,
I would cry about it in an instant.
Right. Because when I met you and we talked, you were teary-eyed within
immediately
almost
cried.
Within a second, right? I'm like, so, okay, how can I help you? What's going on? And boom, you were full of emotion, right? Because you were sad and scared and desperate and all this. And, if that same laceration, that same trauma was on your shoulder, you'd be upset. I mean, you're going to wear a bikini one day, you're going to wear a sleeveless dress.
Yeah.
But you're not going to be devastated the way you were being, right? Because it's not the middle of your face. Yeah. So I think it's really interesting and fascinating, and for people to recognize the value of feeling secure in the way you look, and then understanding how these minor things, and not to suggest yours is minor, but these small things can have such a major impact in our lives. So you then ended up seeking out guidance, like, okay, shit, I can't stay like this. So what am I going to do? And so you came to me and we discussed, you came to me at 3 months, right?
Yeah.
Okay. And you came to me and you said to me, hey, you tell me how it all went down for you.
I go in and I'm telling you what happened and what can be done. And you were very supportive about the whole thing. And, basically it needs to stay like this for a year before we can do anything about it. And
What?
I think I cried again.
What? I'm sorry. Excuse me, Dr. Rahban. What the hell did you just say?
Right.
Come again?
Like,
I'm coming to you to
today,
fix my
we
lip.
can't do this tomorrow.
I'm coming to you to fix my lip, and you told me I got to stay like this for about a year?
Yeah.
What? You crazy. Hell no. No. Why on earth would I need to suffer for a whole damn year? And for that, we'll discuss when we get back after the break. But I think that's really important because I don't think you expected it. Obviously, you were in tears yet again. And we'll elaborate a little bit. We're going to take a break, and then we're going to come back. And then what we're going to do is we're going to talk about what are my options. So this thing happens to me. I fall. I get bit by a dog. I get into a fight. And this horrific thing happens to me. What the hell are my options? We're going to figure that out when we come back from the break. So you better tune in. Welcome back to Plastic Surgery Uncensored. All right, so we left you kind of hanging, which was here's this beautiful young lady, underwent this horrible, horrible accident, had a terrible scar to her lip, big old, huge inflammation on the right side of her lip, and she's come to you and she's looking for you for guidance, and you look at her and you tell her, I can't help you now. You need to let this kind of hang out for a year. And of course, naturally, you're like, what the hell, why? And the reason is the lip is very unique. I have a sort of a subspecialty-ish in lips. I do a lot of lip reductions and lip surgery, and lips are not like other areas. When they get traumatized, they swell up, and that swelling gets trapped in there like a rock. And when I would touch your lip, it was as hard as a gumball. Do you remember that?
Yeah.
It was like literally there was a marble inside your lip. So it was fat and wide and large, aside from the scar that was thick and raised. So the reason why I told you to wait is if you go into that wound at 3 months and try to improve it, you are essentially operating in the eye of the hurricane. You're like running out in the middle of the storm and trying to, I don't know, wash your car or dry your car. It doesn't make sense. That wound, particularly the lip, was very, very inflamed. And in order to be able to make heads or tails of your lip, because it's such a unique anatomy, millimeters matter. Millimeters matter. We needed to let your wound calm down, soften, relax, and determine what it will look like when it's all settled before we could fix it. That requires a significant amount of discipline on your end because you wanted it fixed yesterday. And I'm telling you, not only can I not fix it yesterday, I need you to stay like this for a while. How did that go over?
It was hard to hear. I knew it was the truth though. You have to let your body heal. You have to let it do what it needs to do naturally. It was relieving though, in the same breath, to hear that something could be done. But now you have to wait, and now you have to just live with this until we can do something about it.
All right.
Yeah.
So let's talk about what options are there and then what we did. So option number one is I'm a girl and I have this sort of this is not you, but I'm a girl and I have the scar on my lip. It's not so great, but when I wear lipstick or lip gloss or any type of makeup, it's essentially imperceptible. Well, then the answer is that's your treatment, because doing surgery on the lip is very tricky and you will not guarantee that it will necessarily be better. So if indeed your scar or abnormality of your lip is minor and can be camouflaged and you're a girl, then you should take advantage of that. Clearly, that was not the case in your instance because the scar was really thick and couldn't be covered. And the size of your lip was not going to go away because of makeup. The next thing you can do is you can actually tattoo scars, add pigment to them, change the color. People tattoo their lips all the time. And if the case is that the issue with your scar is that it's not red or purple like your regular lip, but otherwise it's imperceptible, it's just the color, then you can consider maybe tattooing it. You can actually go in there and add color. Again, in your instance, that was clearly not a possibility because your issue was a texture issue, not just a color issue. And again, it was a size issue and an asymmetry thing. What about adding filler? Well, if you add filler, where the hell are you going to add the filler? You're going to add filler to the other side that's normal. And you're going to fill up the side that's normal to make it look like the side that's got scar tissue in it. Because at this juncture, let's say you come back at a year and your lip is softer. It's not soft because the scar tissue that forms inside the lip is kind of semi-permanent. So it's much softer than it was when we met, but it's still kind of a little got rubbery hardness to it. And it's never going to get smaller because your lip has added this extra volume to it. So the way to deal with filler is you got to add filler to the normal side if you can, to kind of camouflage the asymmetry. In your instance, the problem was that the right side was so big that we would have to make your lip huge. And obviously it was temporary and it wasn't an option that we had wanted to consider. But slight irregularities can sometimes, and you got to be very careful with this, can be filled in using a little bit of filler. Just know that it's temporary and it will go away and you basically go back to where you were. The next thing is you can do a scar revision, right? You can just cut out the scar and then sew it back together, which in your instance was one of the two things we did. So what did we ultimately do with your lip? Tell me what we did and what we had to ultimately do.
We did several surgeries. We did a scar revision and we did a couple of lip reductions.
Okay. So the scar revision was to do what?
The scar revision was to cut out the old scar and create a new and better scar for the outside that was on the lip.
Right. So you had a lip, you're looking at the face of your lip, and well, I'm going to describe the anatomy for people so they understand. Why is a lip so unique? Because it has a lot of unique anatomical subunits. So when you look at someone's lip, right, it's pink. There's the part that's within the inside of the mouth. It's called the wet vermilion, wet being the moist part, vermilion being the pink part. Then there's a little transition, and then there's the upper half of your lip, which is the dry vermilion. Then there is what's called the white roll, which is the edge of your lip on the upper lip, which transitions your lip proper, the pink part, to the top of your lip, which is just where in men there's a mustache or the top. And then there's the philtral columns, which are those two middle things that connect your lip to your nose. So anywhere you get a break, a cut, or separation along those anatomical units, it's going to be as obvious as day, right? If you look at someone who's had a cleft lip, it splits right through all those units. It goes from the nose to the lip, right through the philtral column, down through the white roll, right through the wet and dry vermilion. So in your instance, the scar that you had that was traumatic, that was sewn together by the plastic surgeon, was it went from the white roll through the dry vermilion, through the wet vermilion. So basically the entire surface of your lip had this jaggedy scar through it. And it was raised and irregular and tight and whatnot. So what our goal was to cut it out and try to sew it together a little bit more eloquently, because you're not in the middle of a tornado, right? We're never going to make it go away, but we want to make it a little bit more subtle, hopefully to the point that it's flat enough and small enough that you could cover it up with a little lipstick or lip gloss. How did that go?
Better than expected. But yeah, it's the healing process and you have to be patient and you have to work through that. We did that before the lip reduction. So still very emotional, but it healed and it is much better.
Okay.
Much better.
So we've addressed one issue. And then the second issue is we did a lip reduction. What the hell is a lip reduction?
So then we did the lip reduction, took out some of the lip to make it look more like the other side. So
right. So we're removing, now we fixed the surface of it. And now we're trying to create a better harmony between the left and right side. Your left side is a normal lip. And then your right side is much bigger than your left side. And again, unless you're going to put volume into the other side, you got to remove something from the side that's scarred. And so what we do is a lip reduction. It's a very tricky surgery, hence why we've done it in stages. And the reason we've done it in stages is if we over remove or over resect, now your right side is smaller than your left side. So we have incrementally removed slivers of your lip in a lip reduction in order to create the same width and create more harmony. And I assume at this juncture, and we may very well not be done, but we have made significant strides, would you say?
Yes. Yes.
So the question then becomes is, who gives a crap if your lip looks better or not if you're still super self-conscious? So the question that we really need to know is, now that you are 3 years out from this horrible experience and you've gone through this really challenging journey in your life, where are you mentally when you're talking to your loved ones or meeting someone at the office, in terms of how you see yourself in terms of insecurity?
Oh, I am much more confident. I don't feel that insecurity that I felt 3 years ago. Obviously, it is still something that has happened to me, and I do still have my scar, but it's so much better, and I don't feel uncomfortable when I have conversations. When I walk into a room, I don't feel like that's the center of attention. Yes, it's a scar. We all have scars, and I live with my scar now, and it's mine, and I own it, and I'm not insecure about it anymore. And I'm so thankful. Thank you, Dr. Rahban, for helping me through all of this. Because yeah, scale of 1 to 10, 10 all the way. I feel so happy about it. So glad I did.
Yeah, and that's really that's really the journey that we wanted to discuss, which is that a person, all of us, anyone listening right now, sitting at home, just chilling, like, all right, this sounds like an interesting story. Boom, you walk out your door to go pick up pizza, and boom, you're this person now we're talking about. Literally, that's what it is. Shit happens all the time, and the reality is that in a moment you go from being this totally normal, confident person. God forbid something terrible happens to you, and now you're in this deep abyss of emotional uncertainty. And then you have to manage and pull yourself together and to go through this journey. And you did an amazing job. You were obviously emotional. You got your shit together. You seeked out guidance. You were patient through the process. And, your journey is never complete, but you're back to a place that is arguably whole and normal. And as you said, you've made amends with this scar and experience that you had. And so that's really why we wanted to have you on, because I think it highlights so much of trauma in general, and you did it with grace. And I'm just happy that you're happy, really, at the end of it. You see you smile with, you can see your beautiful teeth, all that. I don't know, your parents probably spent a boatload on orthodontics. They were like pissed off that you weren't smiling anymore. So now they're happy, everyone's happy.
Yeah.
Well, as always, thank you for, anytime a patient comes on and is a little courageous, nobody's super excited about being on the show, but then they all kind of feel like it's a little liberating to have shared their story. We really appreciate it. And people, I'm sure, will be grateful that you shared your story. Any parting messages for just people?
Well, if you have something that you do not like and there's something that you can do about it, do it. You won't regret it. And live with your scars. They're beautiful. They make us who we are. They're an experience. But if you want to fix it, fix it.
That's great.
But do your research. Please
do your homework.
Please do your research. Anyone will do anything you ask. You'll find someone that will do anything you ask them to. But once it's done, it's done. So do your research.
All right. I think those are all excellent messages. Well, anyways, that wraps up another fascinating episode of Plastic Surgery Uncensored. If you love this show and you appreciate the content, please help us get the message out. Share it with your friends, download it and subscribe, and join us next week with our next episode of Plastic Surgery Uncensored. Till then, have a great week.
Thank you for listening to Plastic Surgery Uncensored with Dr. Rady Rahban. We would love your feedback. If you enjoyed this episode, or if you find our podcast helpful, tell us why. Leave us a review and make sure you subscribe on your favorite podcast platform. If you have a topic you would like for us to discuss in an upcoming episode, please reach out to us on Instagram at Dr. Rady Rahban, on Facebook at Rady Rahban, or at RadyRahban.com.